Namaskar and welcome to StudyIQ. I am your friend Rahul Saigaonker. The agenda for today's discussion is connected to human health and nutrition. We are going to discuss about vitamins with a special focus on vitamin D. Now you have a query in your mind, sir, why are we discussing about this now? Because recently a study has been published which has highlighted that optimum intake of vitamin D can reduce cancer-based mortality by 15%. We'll talk about this study, we'll get some details from it. But before that, we'll have a general interaction about vitamins to understand vitamin D in a better way. I would say that this is a very important discussion from UPSC civil services perspective, especially from the point of view of prelims. In general also, it is a very significant discussion to understand the necessity and importance of vitamin D for human health. So please spread the word, share this video so that it reaches to maximum number of people who understand its importance. All right, let's begin. But before that, there is a small notice for all the UPSC civil services aspirants. StudyIQ is offering prelims to interview program. The August batch, the evening batch, is starting at 6 p.m. 23rd of August. The question is, why should you join this? This is the most comprehensive program for UPSC civil service preparation, where we will be guiding you through prelims, through mains, through interview, all the stages. If you clear your preliminary examination 2024, you would be called to the Gurukul of StudyIQ, which is the mains residential program, where you'll be learning with faculties and mentors. Mock interviews are also planned. A comprehensive package at a very affordable price. For maximum discount, use my code Rahul Live, which is applicable on website as well as the app. Enroll now. I'll see you in the class. Right. Let's talk about vitamins, or if you want to pronounce it as vitamins, it's very fine. Vitamins or vitamins. You do know that vitamins are these organic compounds which are extremely important for functioning of human body, although they are needed in very minute quantities, but their significance is extraordinary. These organic compounds, they are responsible for maintaining our health and bodily function. There are different kinds of vitamins that we need: vitamin A, D, E, K. We need vitamin B complex, and vitamin C. There are many vitamins which our body cannot produce. In fact, I can say majority of vitamins, they cannot be produced by our body. One of the examples which we can synthesize is vitamin D itself. But for that, we have a requirement. We need to go into sunlight. Sunlight helps synthesize vitamin D in our body. But the other vitamins, we need to make it a part of our diet. That is why we talk about balanced diet. A balanced diet is one which comprises of optimum amount of carbohydrates, proteins, and fats as well. It should also include roughages, and then it should have optimum amount of vitamins and other micronutrients that we need. Although these micronutrients, say vitamins, they are needed in very small quantities, but their absence causes very huge problems. Their deficiency leads to different kinds of diseases. So ensure that in your food you have necessary vitamins that are needed for our body. All right. Now the question is, sir, what are the vitamins that are required for our body? As I told you, vitamins A, D, E, K, these are fat soluble vitamins which are very essential for our body. Apart from that, we also need vitamin B and vitamin C. Why am I telling this? Because multiple times questions have appeared which are connected to vitamins. Let me give you a template of one question which appeared in UPSC preliminary examination. Consider the following pairs: vitamin and deficiency diseases. You have to tell which are correctly matched. These are the options. You can attempt it. But these days, the options are also changing. Right now, they're not asking which of the above pairs is correctly matched. How many pairs are correctly matched? Such options are also coming up. But nonetheless, I hope you understand that the content remains this. So what are the fat soluble vitamins? A, D, E, K. Remember this. If somebody is on dieting and they say, I'm not going to consume any oil, any fat, it is quite dangerous, because our body needs fat, right? Say if you have a target of reaching single digit fat, that is a very good thing, but you need fats in your body to basically use these vitamins. We have 4 fat soluble vitamins. Vitamin A. Vitamin A is basically retinol, which is responsible for healthy eyes. If there is deficiency of vitamin A, it leads to night blindness. Vitamin D, we'll talk about that at length. There is vitamin E, which is tocopherol. Vitamin E and its deficiency, it leads to anemia. Vitamin E is also called as the beauty vitamin or the fertility vitamin as well. You must have seen the example of Evion tablets, which are nothing but tocopherol or vitamin E. Then there is fat soluble vitamin, which is vitamin K. We find two variants of that. One is phylloquinone, one is menaquinones, right? Menaquinones, right? Now, these are responsible for clotting of blood. If you do not have vitamin K in your body, then if you get even a simple scratch, the blood will be continuously flowing. These four are the fat soluble vitamins. Apart from that, we have vitamin B, which is a complex. There are different vitamin B complexes. Vitamin B1 is thymine, B2 is riboflavin, B3, B5, B6, B7, B9, and B12. We also need vitamin C, which is basically ascorbic acid, and we consume a lot of citrus fruits to get vitamin C. Now you will be having a query. So do I have to mug up these things? There is no need to mug up these things. Again, this is present in your NCERT as well. You need to focus on which vitamin leads to what kind of diseases. Such questions have come. For instance, vitamin B1 and its deficiency leads to beriberi. Vitamin B3, its deficiency leads to pellagra. Vitamin C, its deficiency leads to scurvy. Now, human body, it cannot produce vitamin C, but there are many animals which can produce their own vitamin C. So it depends from individual to individual. We need to take vitamin C from external sources. That's why we consume citrus fruits. All right. So this is a general overview about different vitamins. Our focus is on vitamin D. Now, vitamin D, it is an organic compound. It goes by the name calciferol. It has two variants. One is ergocalciferol, one is cholecalciferol, vitamin D2 and vitamin D3. Now, what is this importance of vitamin D? Vitamin D in our body, optimum amount of it, it helps to regulate the amount of calcium and it helps to regulate amount of phosphate in our body. And both calcium and phosphate, they are extremely important constituents of human bones. These nutrients are needed for health of bones, teeth, muscles. Lack of vitamin D can lead to rickets. It's a bone-based disease in children, and in adults, it can cause osteomalacia, or your bones basically get weaker. Now, the question is, sir, how do I get vitamin D? Right? From where do I get vitamin D? As I told you, our body has a mechanism of synthesizing vitamin D, but there is some input which is needed. Our skin, our epithelial cells, epithelial tissues, they have certain kind of mechanism where fat in those cells can turn into vitamin D if sunlight is provided to it. If you just get sunlight for say 15 minutes in a day, then 7-dehydrocholesterol, it transforms into cholecalciferol, which is basically vitamin D3. And this vitamin D3, it is utilized by the liver, by your kidney, so that your calcium and phosphate quantities are utilized or are in the optimum level in your body. If there is any kind of deficiency of vitamin D, it leads to a lot of problems in your bones, in other parts of your body as well. We'll talk about deficiency in some time. So one thing is, you need to understand, my body can synthesize vitamin D if I get optimum amount of sunlight. Imagine if there is no sunlight, then where can I get vitamin D from? You have to consume foods that have vitamin D. And here is a catch. Foods in general, they have different kinds of vitamins, but vitamin D based foods are rather rare, I would say, or less in quantity. See, vitamin D can be obtained from dietary sources like fatty fish. And many people who are vegetarian, they find, I cannot consume fish, I cannot consume meat. You get it from red meat as well. But you can also find vitamin D from dairy products. If there are fortified cereals, these days food is being fortified. So in fortified cereals, you might get vitamin D. But you can have vitamin D from egg yolk as well. So for vegetarians, I would say the options are rather limited. Consume dairy products, and you can consume some mushrooms which have a lot of vitamin D. And if you do not consume them, or if you lack vitamin D, if there is a deficiency of vitamin D in your body, it leads to a lot of problems. And please remember, in summer days, it's not a problem. See, now there is a question in people's mind, sir, we are wearing complete clothes, and if I go into sunlight, will I be able to synthesize vitamin D? Yes, of course. Even with 20% exposure to sunlight, vitamin D can be produced by your skin, by the epithelial tissues. But during rainy and winter season, sometimes it happens that you cannot go out of your house and get sunlight. So that time, ensure that you have optimum intake of vitamin D through your dietary sources, or you can also take supplements. Because if there is vitamin D deficiency in your body, it leads to rickets, it leads to osteoporosis, osteomalacia. It can lead to many other problems connected to your pancreas. It can lead to diabetes, it can lead to liver based diseases, it can lead to asthma, it can cause depression, schizophrenia, it can lead to high blood pressure, muscle weakness, different kinds of diseases like Crohn's disease, cancer. Again, remember, cancer, influenza, tuberculosis, etc. These diseases can have the reason that your body is deficient in vitamin D. All right. Now, recently I told you there has been a study which has highlighted that yes, of course, vitamin D deficiency leads to ricket, osteoporosis, osteomalacia. I know, but if you do not take optimum amount of vitamin D, then you may not be able to fight cancer in a better way. That has been highlighted by a study. This study highlights that if you take vitamin D in optimum quantity, the mortality connected to cancer can be reduced by 15%. And what is this study? It was published in Elsevier. Again, it will come up in the September edition now, where they have studied vitamin D levels and their intake among Brits, and the sample space is quite high. The results of the data that was analyzed, the data was of more than 4 lakh Brits aged between 40 to 69. So very important. You must have seen that in middle age and in old age, you get a lot of problems connected to bones, arthritis, weak bones, osteoporosis, osteomalacia, all these problems. That's why I told you, please share this video, share this information with people, elderly people or people connected with them, so that they get the idea and they have optimum supplements of vitamin D. Now, what these results show is they analyzed more than 4 lakh British citizens and their data, which was already with a database, where they have seen that vitamin D deficiency was seen in 21% of population and insufficiency was seen in 34% of population. And people, they were taking vitamin D supplements as well. And of all the people who are involved, and from their data, they saw that 4.1% people, they regularly took vitamin D supplements, and about 20% of people, they took some sort of multivitamin which had vitamin D3. All right, so you know there are so many examples of multivitamin in India as well. There's Revital, Maxirich, so many multivitamins. You will find some optimum amount of vitamin D3 there as well. So some people took specific vitamin D3 supplements, some people took multivitamins, and the results that were shown quite extraordinary here. Those who took vitamin D supplements, in them there was 15% lower chance of cancer-based mortality and 25% lower chance of cancer-based mortality, lung cancer-based mortality. Now, please remember, when I talk about cancer, I would like to highlight that vitamin D deficiency can help you fight or reduce the mortality connected to cancers, particularly of bowel, stomach, prostate, and lungs. Very important. All right. So this was basically out of the study, and they have seen that those who do not take supplements or those who have vitamin D deficiency, apart from the bone connected diseases, there was a very high chance of cancer based mortality as well. Now you have a question, sir, why does this happen? Again, this study could not conclusively answer that, but there have been some conjectures, some reasonable explanations, where they highlight that vitamin D supplements, they may induce some anti-inflammatory, antioxidant mechanism in human body, where they also promote DNA repair mechanism. You do know the reason for cancer. Now, whenever I ask students what is the reason for cancer, can I say cancer is a genetic disease, not a disorder, genetic disease? Many say no. The root cause behind cancer is change in your DNA structure only. In some cells, the DNA structure or DNA has changed. There has been some modification in DNA where it is now dividing or it is multiplying with an uncontrolled scale, basically. That's why you get your tumors, right? So vitamin D can enhance DNA repair mechanism in human body. That is one of the plausible explanations which has been given by these scientists. Although in the paper, they have not explained anything conclusively, but these are some of the explanations for that. Right? I hope you do get the importance of vitamin D. Now, apart from that, you will have a question now. So I'm listening very carefully now, right? I'm listening very carefully that you told importance of vitamin D. The question is, how much vitamin D do I need for my body? Now, this is the standard recommended daily intake of vitamin D. For infants 0 to 12, they need about 400 IU. This is the 400 international unit, which basically comes down to 10 mcg. And this is the basic intake for adults. For adults, they need somewhere around 600 IU, right? 600 international units. Now, you have a question. Sir, I don't understand. I don't get this IU. I don't get how many grams is produced, but now you told me I can synthesize, or my body can synthesize vitamin D if I go into sunlight. So for how much time I have to stay in sunlight? All right. Now, on an average, in tropical countries, we are a tropical country, yes. In tropical areas, if you are 20% uncovered, and if you spend about 10 to 15 minutes in sunlight, it is not necessary that you only need morning sunshine. You can stay in sunlight till your afternoon, no problems. All right. So if you spend 10 to 15 minutes, sun exposure is given, then you can, or your body can synthesize about 1000 IU, and you do know that your input is just 600 IU that is needed. So 10-15 minutes of sunlight is more than enough for daily requirement of your vitamin D. So go out, spend some time in sunlight every day. If you do not have sunlight, especially in the higher latitudes, people have to take supplements. You do understand that if I go to higher latitudes, say latitudes of about 60 degrees, 60, 70, 80 degrees in very cold areas, there's seldom any sunlight. So what do? You take supplements of vitamin D. All right. Now, another question is there, sir, how much time do I have to stay according to my latitude? Now, this is the time period in general for your tropical, equatorial, subtropical regions. Hardly 5 to 10 minutes of sunlight is more than enough. But for others at higher latitudes, they have to stay for a little longer time for the optimum synthesis of that vitamin D. All right. Now, there are some people who think now vitamin D is extremely important, so I'll keep on taking too much of vitamin D supplement. Again, too much of anything can be very dangerous. So please remember that, be very cautious. Extra vitamins, they lead to hypervitaminosis, and toxicity is there. Vitamin D toxicity happens. In general, other vitamin based toxicity can also happen. I've seen many people, as soon as they see some inputs or they see some influencer telling you take this multivitamin, that multivitamin, they will be taking multivitamins every day. It's not advisable. All right. So optimum amount of vitamin D is needed. If there is too much vitamin in your body, it also leads to problems like dizziness, appetite loss, thirst, headache, fatigue, nausea. It can also lead to problems to your liver and kidney as well. So ensure that you get optimum amount of vitamin D, the best source. Do not try to avoid, I would say try to avoid external sources or external supplements. Just enjoy some sunshine. That's the best solution to get vitamin D requirement or fulfill the vitamin D requirements of your body. All right. Right. That's the detail, or that's the end of our discussion for today. I hope this was informative for you. And as I told you, please try to share this video to whoever you think they might need it. If you have any relative, any person at your home who are quite introverts, who do not go out at all, tell them go out, get some sunshine. Sunlight is extremely important for everybody. All right. And with that note, let me end this discussion. Thank you very much. If you have liked this video, you can always follow me on this particular ID at the rate Rahul Sai 222. Thank you again. Jai Hind.